Welcome to This Explainer. As pharmacists, you are right there on the front lines, and you play such a vital role in HIV care. So today, we're going to distill the latest HIV treatment guidelines from our source material into those key counseling points and clinical pearls you can actually use in your day-to-day practice.
First things first, let's just set the stage. It is so important to remember and to tell our patients that with modern combination antiretroviral therapy, what we call CART, the whole outlook for people living with HIV has been completely transformed since the 90s. We've gone from what was once a fatal diagnosis to a chronic, manageable condition.
So here's our game plan. We're going to follow the patient's journey. We'll kick things off with the goals of therapy, walk through the initial assessment and how regimens get picked, and then we'll really zero in on our role as pharmacists in adherence, before wrapping up with the huge public health impact of effective treatment.
Okay, let's dive right in. You know, to be really effective counselors, we've got to be crystal clear on what we're actually trying to do with this combination antiretroviral therapy. What's the why behind it all?
The goals here are really twofold, and they're both equally important. For the individual patient, it's all about prolonging a healthy life. We do that by slamming the brakes on the virus and protecting their immune system. But on a much bigger scale, it's also about preventing new infections, and that's a huge idea we're definitely going to come back to.
So with those goals in mind, let's build on that. Before a single pill is prescribed, a really thorough initial assessment is absolutely crucial. This is what sets the patient up for a successful treatment plan. You've got this three-step process: the history, the physical, and the labs. This whole thing gives the clinical team a complete picture of the patient. Now, for us as pharmacists, understanding that lab component is key because it directly impacts the medications you'll see coming across your counter.
So when you see a new HIV prescription, these are the labs that have shaped that decision. Of course, you'll be keeping an eye on the viral load and CD4 count trends, but there are two tests on this list that are critical right from the get-go: the drug resistance test and that HLA-B5701 screen.
And this is a big one. Screening for this genetic marker is mandatory before a patient can even think about starting a regimen with abacavir. So if you see a script for something like Triumec, you can bet this test was done and it came back negative, because a positive result, that's an absolute lifelong do not use.
All right, so once all that foundational work is done, we can finally look at the structure of the most common modern CART regimens, the ones you'll be seeing every single day.
This simple formula, 2 nukes, or nucleoside reverse transcriptase inhibitors, plus 1 integrase inhibitor, is the gold standard right now. It's the most recommended combo for patients who are new to therapy. Why? Well, it's powerful, it's generally really well tolerated, and it has a high barrier to resistance, which is fantastic.
And here's what that looks like in the real world. You'll definitely recognize these drug names from those powerhouse single-tablet regimens like Biktarvy or Trumec. You know, co-formulating all these drugs into one single pill, taken just once a day, that has been a massive leap forward for helping patients stick with their treatment.
And that's the perfect lead-in to what is maybe the most important part of this whole talk. Let's really focus now on what our source material calls the single biggest challenge in managing HIV.
This quote just nails it, doesn't it? It perfectly illustrates why your role as a pharmacist, providing that constant counseling and support, is so incredibly critical for long-term success. I mean, the best drugs on the planet are useless if patients don't take them consistently.
So these are your go-to talking points before that first dose is even taken, and at every single refill, it's a new chance to check in. It's so important to reinforce that skipping doses doesn't just make the medicine less effective, it actually helps the virus develop drug resistance, which can seriously limit their options down the road.
Okay, this right here is a huge counseling pearl that you can use to prevent a totally avoidable problem. For patients taking integrase inhibitors, and that's a lot of them, in drugs like Biktarvy, Triumec, and Tivicay, they have to know that their morning multivitamin, or that Tums they grab for heartburn, can literally stop their HIV medication from working if they're taken too close together. This simple piece of advice is just crucial.
Here's another really critical point. Tenofovir disoproxil fumarate, or TDF, you'll see it in older combos like Truvada and Atripla, can be tough on the kidneys and bones over the long haul. This is exactly why you'll see a lot of patients getting switched to the newer version, tenofovir alafenamide, or TAF. For any patients still on TDF, it's a great chance to talk about why their lab monitoring is so important, and maybe chat about their calcium and vitamin D intake.
And finally, while you won't see them as often for first-line therapy anymore, you will definitely still have patients on protease inhibitors or NNRTIs. These drug classes are just notorious for their CYP450 drug interactions. This is where you become the essential safety net. Anytime a patient on one of these drugs starts, stops, or changes anything, prescription or over-the-counter, a full interaction check is absolutely non-negotiable.
Okay, last section. Let's zoom out and connect all the dots. The adherence counseling you provide to one single patient, it has this massive, incredible ripple effect on public health.
This is the whole idea behind treatment as prevention, or TASP. By helping every single person with HIV get to and stay at an undetectable viral load, we, as a community, literally break the chain of transmission. We can make a huge dent in the entire epidemic.
And the evidence for this is it's overwhelming. When a person has a consistently suppressed, undetectable viral load, their risk of sexually transmitting HIV to a partner becomes practically zero. This is the science behind that powerful U equals U message, undetectable equals untransmittable. And the source material backs this up with hard data. This isn't just a clinical fact. It is one of the most empowering messages you can ever share with a patient. It lifts this enormous psychological weight, it fights stigma head-on, and it dramatically improves their quality of life and the relationships.
And that really is the key takeaway today. Every refill you handle is so much more than just a transaction. It is an opportunity. It's a chance to reinforce that taking their medication every single day not only protects their own health, but it also protects their partners and helps to end the HIV epidemic. It's a chance to empower your patients and truly change lives.